If an MRI result shows that there's a large tumor, be it benign or malignant, then invariably surgery is required to treat those tumors. Benign tumors essentially cause destruction from its growth, cause compression of the brain. So surgery will then be required to remove the benign tumor and to also prevent further damage of the surrounding brain structure. So for example, if the tumor is sitting on the front part of the brain, you've got a benign tumor, the front part of the brain is being compressed over time. And if nothing is done about it, tumor keeps growing and there will be more brain compression and brain damage. So hence surgery will be needed to remove the tumor to prevent further brain damage. And once the tumor is removed, we can identify based on histological sampling the tumor type or the subtypes and see whether the tumor needs to be treated further with radiotherapy or chemotherapy, or surgery is cure enough for such cases. If you have a malignant tumor or a cancerous tumor, which is less than 2 centimeters, in my opinion, I think the best thing to do would be to obtain a biopsy. This biopsy can be done through a minimally invasive approach to identify the cell types that are involved. And subsequently, these small malignant tumors can be safely and effectively treated with radiotherapy, provided that they remain small. When you have a malignant tumor, which is large, more than 3 centimeters, then surgery would be needed to remove the tumor, because tumor is causing destruction to the surrounding brain tissue. If left alone, the destruction process will not stop, will only progress, and you have damage to more and more brain tissue, and that will result in very bad outcome for the patient. Patient will probably be rendered paralyzed or worse if the tumor is not treated. Surgery will then be done to remove the tumor. At least 90 to 95% of the tumor is removed by surgery. And then subsequently, once we've identified the cell types, we can use radiotherapy or chemotherapy to eliminate the remainder 3 to 5% of tumor that may have been left behind, to make sure that the best treatment to eradicate the tumor is then given. Tumor response to treatment essentially depends on the type of tumor that we're dealing with. Certain tumors respond rather quickly, certain tumors are not very responsive. Essentially, we're looking at a time frame of up to 6 weeks of radiotherapy and chemotherapy. Typically for tumors that arise from the brain, primary brain cancers such as glioblastoma multiforme, these tumors are treated with a regime lasting up to 6 weeks. And then depending on the response of that tumor to the regime of treatment given, treatment can then be continued into a maintenance phase, or perhaps maybe a different type of chemotherapy is used to further control the tumor if necessary. Some treatments may last longer than that, up to 3 months. And that really depends on the tumor response to the chemotherapy or radiotherapy that is given to the patient.